As you get older, you're more likely to lose your teeth from gum disease than tooth decay. How do you know if you've got it? You can't tell by simply looking at your gums, because often these are just swollen. What we're after is where your gum is actually attached to your tooth, and so we do a screening which we call the BPE, and it indicates how much actual healthy bone you have underneath the gum that you can't see. Enter your scores in the My Teeth section of the app, and there's an explanation of what these are. So if you have active gum disease, then you need to do a little bit more cleaning than you may have done in the past. And we need some different brushes, interdental brushes, and these come in a variety of sizes depending on the size of the gap. And there are lots of varieties of these aids, and have a chat with your hygienist and dentist for what works best for you. Some have got handles, some have got wire bases for the brushes, and some are silicone, which a lot of people seem to find a bit easier to use. It's far better to have something that you use rather than something that you may use. And the action is the same for all of them, is you put it in the gap and then give it a little twisting motion. And basically we're trying to reduce any bleeding that may be there, because the bleeding is the sign of inflammation, which is basically disease. And that's what can affect your gums, or rather the bone supporting your teeth, and that's when they wobble out. So you can use the app to set reminders just to encourage you to get into these good habits.